There is a bottle in a Harvard study with the word placebo printed on the label. The doctor tells you to your face that the pills inside are inert, that there is no medicine in them at all, and then asks you to take 2 of them a day for 3 weeks. The patients got better anyway. That's called an open-label placebo, and it shouldn't work. The entire story we tell about placebos is that they work because you've been fooled. Take the deception out, and there's nothing left to do the fooling. And your first reaction is the right one. It sounds like a trick, or a study that got fudged, or people being nice to a doctor who was nice to them first. Hold on to that thought. You're going to need it later. Okay, so let me make it make sense. The first real trial ran at Harvard between August 2009 and April 2010. Ted Kapchuk and Anthony Lembo took 80 people with irritable bowel syndrome, all of them sick enough to score at least 150 on the standard severity scale. Half got nothing. Half got a bottle-marked placebo. And the wording matters, so here it is. The pills were described as placebo pills made of an inert substance, like sugar pills, that have been shown in clinical studies to produce significant improvement in IBS symptoms through mind-body self-healing processes. Then a 15-minute conversation with 4 points in it. The placebo effect is powerful. Your body can respond automatically like Pavlov's dogs. A positive attitude helps but isn't necessary, and taking the pills faithfully is critical. Here's the bit most coverage skips. The control group wasn't ignored. They got the same doctor and the same amount of time in the room. The only thing they didn't get was the bottle. At day 21 on the trial's main outcome, the placebo group scored 5.0. The control group scored 3.9, p equals 0.002, so they went bigger. 2016, the journal Pain, 97 people with chronic low back pain, 83 of them analyzed. Everybody stayed on their normal treatment. One group got the honest placebo added on top of it. And I want that word to land, on top. In these trials, nobody stops anything. The pills are never instead of care, and none of this is advice. 3 weeks later, the placebo group's pain had fallen 1.5 points on a 0 to 10 scale. The other group fell 0.2. Disability dropped by 2.9 points, while the comparison group moved by exactly 0. 2018, 74 cancer survivors carrying long-term fatigue. Same design, same 3 weeks. Fatigue severity improved 29% more in the placebo group, effect size 0.63. Then they did something clever with the leftovers. They offered the placebo to the control group afterwards, and those people improved too. Meanwhile, the original placebo group came off the pills and went flat. At this point, you could fairly say it's a Harvard thing. One lab, one method. So, 2019, Essen, Germany. Completely different team, led by Ulrike Bingel. 127 patients with chronic back pain. Pain went down, so did disability, and so did their depression scores. They also measured spine mobility, an actual physical measurement of how a back moves, taken by somebody who is not the patient. Nothing, no change at all. And that one line is the whole video. Because in August 2025, a team led by Johannes Fendel gathered every randomized open-label placebo trial they could find. 60 trials, 4,648 people. The biggest look at this that exists. Overall effect, 0.35. Small, real, and it held up under a publication bias check. Then they split it in half. Outcomes where a person filled in a questionnaire about themselves. 0.39. Outcomes measured by a machine, a stopwatch, a blood test. 0.09. Not significant. Same pills, same patients. 2 different answers depending on who was holding the measuring tape, their own sentence. Open-label placebos improved self-report outcomes but had no significant effect on objective outcomes. That's the pro-placebo side of the field saying it. The pills move the report. There is very little evidence they move the disease. Right, now let me make the strongest case I can that none of this is real. 2 Danish researchers, Asbjørn Hrobjardsson and Peter Gutsche, have spent 25 years being the most irritating people in this subject, and they're irritating because they're careful. In 2001, they published in the New England Journal of Medicine, and the argument is almost too simple. Nearly every famous claim about placebo power compares the placebo group to itself at the start. which can't separate a pill working from a person just getting better on their own. Sick people improve. A terrible week gets followed by an ordinary one. That's called regression to the mean, and on a chart it looks exactly like a cure. Think about when you actually book a doctor. You book on the bad day. Nobody rings the surgery on the day it's mildly annoying, so whatever happens next is already tilted towards feeling better before anybody hands you anything. So they only counted trials that also had a group who got nothing at all, 114 of them. On yes or no outcomes, no significant effect of placebo. On measured scales, a small one, and it shrank as the trials got bigger, which is the fingerprint of a bias, not a drug. By 2010, they had 202 trials covering 60 conditions in a Cochrane review. Out of those 202, the number they rated as low risk of bias was 16. Patient-reported outcomes, 0.26. Observer-reported, 0.13. And their conclusion, word for word. It is difficult to distinguish patient-reported effects of placebo from biased reporting. Now the hard one, because this next study came out of Kapchuk's own lab with his name on it. 2011, also the New England Journal. 39 people with asthma, each run through 4 conditions, 12 visits each. A real inhaler, a fake inhaler, fake acupuncture, and a visit where nothing happened at all. The real inhaler opened their airways 20%, the fake inhaler 7.5, the fake acupuncture 7.3, doing nothing 7.1. Now the patient's own ratings of how much better they felt. Real inhaler 50%, fake inhaler 45, fake acupuncture 46, doing nothing 21. Read those 2 lists again. The lungs could tell the difference. The people couldn't. There's more. A 2023 network analysis found the honest placebo beat nothing and beat a waiting list, but did not beat ordinary care. Better than nothing, not better than something. Same analysis found that when you hand someone the placebo without the speech, no rationale, no Pavlov's dogs, it did worse than giving them nothing. So the pill isn't the active ingredient here. The conversation is. And those German back pain patients got followed up 3 years later. Between the group that took the placebo and the group that didn't, there was no difference left in anything. The 2025 review closes by asking for research teams with less allegiance to open-label placebos. That's a field politely admitting it mostly studies itself. Okay. So is there anything the skeptics can't wave away as reporting bias? One thing maybe. In 2020, Darwin Guevara's group showed people distressing images while recording their brainwaves. Half had been handed an honest placebo first. They were watching something called the late positive potential, an electrical spike that gets bigger the more upset you are. In the placebo group, the spike was smaller, nearly 200 people. You can round your answers up on a questionnaire to be polite. It's a lot harder to fake a voltage you don't know you're producing. Although those were healthy university students looking at photographs, not patients and not a disease. And that's the awkward shape of this. The better the measurement gets, the smaller the effect gets. So, here's where it lands. Something real is happening. It shows up in labs that don't like each other, and it beats a control group that got exactly the same amount of attention. It doesn't need you to be lied to, and there's almost no evidence it touches the illness underneath. Nobody serious in this literature claims a placebo clears an infection or repairs a spine. The pain score moves, the spine doesn't. Which leaves a question I honestly can't settle. When someone with chronic pain says they hurt less, and the ruler says nothing changed, which of those two is the real result? Because if the report is just noise, then a lot of medicine is measuring noise, since most of what we treat we measure by asking. And if the report is the thing that counts, then the honest placebo did something, and nobody can tell you what. Maybe a placebo isn't a treatment at all. Maybe it's a test of the instrument. So which is it? Did those patients get better, or did they only get better at answering the question?